Hi, everybody. My name is Elizabeth Wilson. I'm a professor in environmental studies and director of the Arthur L. Irving Institute for Energy and Society. This is part of our New Energy Conversations with Early Career Energy Researcher series that we do with a lot of other universities. And the purpose of this series is to highlight the scholarship of the next generation of scholars. And today I'm thrilled to have Joan Casey from Columbia University, who will be speaking on power outage preparedness, distribution and duration, spotlighting environmental justice issues. As many of you know, we've been really trying to weave the themes of energy justice and equity into our conversations and pair it with the critical energy infrastructures in this climate changing world. So I couldn't think about anyone better than Professor Casey to come and speak with us. She'll be speaking for about 25-30 minutes, and then I'll come back on for the Q&A. Please feel free to type your questions in the Q&A box on the corner. We'll have a moderated discussion, and then we'll end with her last thoughts. And we're really looking forward to this conversation. Joan, welcome, and we're pleased to have you here today.
Thank you so much. Really excited to be here. So let me just get my slides up. Okay. Hi, everyone. And thank you for that super nice introduction. I will, in fact, be talking about power outages and environmental justice. Okay, so brief outline. I'm going to start broadly talking about power outages and who they affect, the issue about where the data is that we need to study power outages in health, and then a little bit of our current work on a nationwide perspective on these issues. And then I'm going to finish talking about a case study that we did related to the spring 2021 Texas power crisis. Okay, so think about the last power outage that you experienced. How long did it last? Was it seconds, minutes, hours? This is the average duration of power outages worldwide. You can see Latin America and the Caribbean, followed by Sub-Saharan Africa, have the longest average durations at almost 8 hours in length. Was this power outage that you experienced annoying? Were you worried you weren't going to be able to look at Twitter on your phone because your phone would die? Or was it life-threatening? Were you concerned you wouldn't be able to charge a medical device that requires electricity that you need to use, for example, an oxygen concentrator? So power outages can mean very different things for different people. Did your home get too hot? So this is an interesting study by Stone and colleagues where they simulated indoor temperatures during heat waves that actually occurred between 1980 and 2009. And so they estimated indoor heat when the power is on, and that's this top panel in Atlanta, Detroit, and Phoenix. And so you can see most homes are gray, meaning there's no exposure risk to heat. And in the bottom panel, they're simulating indoor temperatures after a 5-day power outage event covering this area. And so you can see then indoor temperatures get much, much hotter, particularly in Phoenix that has heavy reliance on air conditioning. A large portion of this population is at a dangerous level for heat exhaustion and possible heat stroke. So this can be really problematic. And then what about, was your home too cold during this power outage? So this is what happened during the 2021 Texas power crisis, when this severe winter storm swept through Texas, demand for electricity went way up, power generation sources failed, and power wasn't able to be brought in from other states because the Texas power grid isn't connected to the other two main electrical grids that serve the rest of the United States. And this is a photo from Texas during that outage. So here's a schematic that we put together trying to think about the relationship between power outages and health. And so you can see over here on the left, several factors that are driving power outages, including our aging electric grid, climate change, and increased climate events like hurricanes, snowstorms, and also increased demand on the grid, both as our population grows and as we electrify our homes more and more. then we can have these power outages. And I just want to note there are a lot of different vulnerability factors that might impact how a power outage actually affects health. And so those can be things like age, young and old people potentially being at greater risk of exposure to power outages, the baseline health status of the people affected, the quality of the housing in which people live, other factors like socioeconomic status or occupational exposures. And the literature has linked power outages to a range of health outcomes. The biggest one that really has shown up to date is carbon monoxide poisoning, people showing up in emergency departments with CO poisoning from inappropriate use of generators during power outages. Other outcomes that have been linked are things like gastrointestinal illness from eating spoiled food, heart attacks, injury, adverse mental health outcomes. And then there's also been disease exacerbation noted. For example, asthma or COPD if indoor air quality worsens or if temperatures change, down to sleep problems and mental health problems. And there have also been a couple studies linking power outages with mortality. Although most of these power outages focus on a single outage event and don't characterize how severe the outage is. It's more of a yes, no, a power outage occurred in this city, and then counting up who shows up at an emergency department. So to really understand the full implications of power outages in health, we need to do a bit better. But where is the data at to do those sorts of public health studies that we need? So the US Energy Information Administration provides data every year on power outages that occurred in the US. They generally summarize this at the national or state level. So you can see here that power outages between 2013 and 2020 appear to be going up, particularly those that occur with major events, and that refers to climate events like snowstorms, wildfires, or hurricanes. And then here is a plot looking at on the y-axis, the total number of interruptions, outages, versus the total duration of annual interruptions in hours. And so you can see states that are doing the worst are up here in the top right-hand corner. So Louisiana has a large number of outages and also long durations of outages. However, to study health, we probably need sub-state level information on power outages. And so when we went out to look for that to start doing some health studies, we couldn't find it. So we then sought first to create this exposure to power outages across the whole US. So to do that, we use data from poweroutage.us. People are probably familiar with this. You see their maps in news stories about power outages. And basically what poweroutage.us does is pulls data directly from utility provider APIs in order to track the number of customers without power over time. And they're tracking customers that are both residential and non-residential. So homes, but also businesses. And so we have information at the sub-hourly level about how many customers are without power in each county across the United States over time. And so we use data from poweroutage.us from 2018 to 2020 to characterize power outages. And this was work really led by Vivian Doe, who's a PhD student in our Department of Environmental Health at Columbia, and also Heather McBrien, who is a research assistant with us. I just wanted to give you a sense of what these data look like. And so basically we had many spreadsheets, including information on the utility name, the county in which that utility operated, and the number of customers that were out without power for any time. We also had information on the total number of customers served by that utility. And so we aggregated this data to the hourly level so that we could estimate for every county the number of customers out every hour from 2018 to 2020. So that resulted in about 79 million rows of data. So then we use this data to characterize power outages at the county level nationwide. So we did this in two different ways. We wanted to create two metrics of power outage exposure. So the first was a relative metric. And so here we wanted to identify or call counties as having a power outage when over 0.5% of the customers in that county were without power. And so we did that to identify both 1 hour and longer outages and also 8 hour and longer outages. And we were interested in the 8 hour outages because we consider that to be a medically relevant power outage, where that would be quite a long time to go without air conditioning or without charging a medical device. And then we also created an absolute metric of power outage exposure. And that was simply the total number of customers without power times the total hours out. And so we created both of these metrics because to consider all the counties nationwide, we wanted to be able to compare urban and rural places and have a metric that worked for both of those. And so that was where the utility of the relative metric came into place. So all counties kind of have their specific threshold over which they need to pass to be considered having a power outage. And then the absolute just counts up, obviously, the total number of people without power in a place, which is also of public health interest. And then we were interested in linking power outages to some metrics of vulnerability to outages. Like I mentioned before in that schematic, there might be certain subgroups that would be at elevated risk of adverse health outcomes during a power outage. And so we selected two. The first was we pulled data on users of electricity dependent durable medical equipment, or DME, among the Medicare population. And so here you're looking at a map of DME users across the US. So basically covering everyone 65 and older in the United States. And the counties in red are those in the fourth quartile or with the highest prevalence of DME use. We also wanted to link in the CDC's Social Vulnerability Index. So the SVI is a index that's comprised of 15 variables from categories like socioeconomic status, race, ethnicity, housing, transportation, and disability. And the CDC's stated goal for creating the SVI was to help public health officials and emergency response planners identify and map the communities that will most likely need support during or before, during, and after a hazardous event. So that seemed like a good match for what we were trying to do. And so with these two vulnerability variables, we conducted bivariate indicators of association. Essentially, this is a spatial analysis to identify places that had, for example, both high levels of vulnerability and also high counts of 8-hour power outages. So those might be places we need to allocate resources in the future. So let me tell you a little bit about what we found with power outages overall. So our data covered nearly 3,000 counties, or 99% of all US counties. We found for 8-hour power outages that over the study period, 92% of counties in the United States had at least one 8-hour power outage. And that there were nearly 25,000 8-hour outages total. During any given year, the median number of outages that a county experienced was 2, and the maximum was 41. And then you can see on the right-hand panel, 1-hour outages were even more common, with 99% of counties reporting at least one 1-hour outage, and the maximum being 396. Here's the distribution, just in a bar chart to give you another sense of what the counts of 8-hour outages looked like. And so these are annual average counts from 2018 to 2020. So you can see the most common was a single 8-hour outage, but we had some counties, as I mentioned, having an average almost of 40 outages over this year, over the 3-year period. So here's what this looks like spatially. These are county yearly average counts of 8-hour and longer outage events. The yellow is an average of 0 up to the black color that represents 7 to 41 outages on average during this period. So you can see places like Maine, Michigan, Appalachia, Louisiana, and Northern California had some of the most power outages during this time period. And here's kind of what this looked like across across the year, so were there certain times during the year where we saw more 8-hour outages? Yes, is the answer. And this also highlights some of the states with the most outages. So this is Texas up here in red. And so you can see outages tend to peak kind of in these shoulder seasons of March through May, and then September through November in a lot of states, although the summer months also have quite a few. And so this big peak in Texas is tied to high counts of thunderstorms and tornadoes in Texas in the springtime. And this is a summary of states with the highest cumulative customer time without power each year. So Texas, followed by California, Michigan, Louisiana, and New York, had over 40 million customer hours without power during each year on average. And then these are the top 5 counties in the United States. So Wayne, Michigan, Oklahoma, and Los Angeles were the leading counties of person time without power. And this is the map of total customer hours without power across the United States. So somewhat similar to that 8-hour power outage map, but we do see some differences now where a lot of the West Coast actually has quite high counts of customer hours without power. And much of the Northeast, Florida now is much darker than it was in our prior slide for 8-hour outages, indicating Florida doesn't have a lot of 8-hour outages, but does have many shorter outages that when you sum them up over time leads to a lot of person time without power. Okay, so we also wanted to look at when power outages were starting during the day across the year. And so just to orient you here, we're looking across months on the x-axis, and then on the y-axis, we're looking across the day. And so here's what this looks like. We see a peak of 8-hour outages that start between about 3 and 8 p.m. in the afternoon between May and July across the country. And this isn't surprising. I mean, this is what we probably would hypothesize, right? Because this is when utilities charge the most for electricity because they have so much demand at that time. And this is when people are getting home from work, turning on the air conditioning or turning on the heat, maybe doing laundry, other things that use quite a bit of power. So then we wanted to look at these outages by those vulnerability metrics. And so we broke up durable medical equipment use into 4 quartiles, with the 4th quartile being the places that had the highest prevalence of electricity-dependent medical equipment use. And you can see that the 4th quartile does appear to also have the highest count of outages compared to the other 3 quartiles, and similar patterning as we saw on that prior slide. Now here are the results of those bivariate local indicators of association, or LISA analyses, and this is where we're identifying essentially clusters of both high electricity-dependent medical equipment use and high counts of 8-hour outages. And so you can see in red, these are the counties where those 2 things clustered together. So Appalachia, Michigan, Louisiana, West Texas, and Northern California. Similarly, we did the same thing for the social vulnerability index. And so here things look even worse, unfortunately, where we see far fewer outages in counties with lower social vulnerability. And when we get to the 3rd and 4th quartile, or the places with higher vulnerability, we see a greater concentration of outages. And here, especially in springtime in the 4th quartile, we see kind of some additional outages popping up. And again, looking at these LISA clustering analyses, we see similar counties actually clustering for high counts of outages and high social vulnerability as we did looking at durable medical equipment use. Okay, so in summary for this first piece of work, we did in fact see a really large burden of power outage exposure nationwide, as you can remember by looking back at this map. High counts of 8-hour outages, which we believe are medically relevant and spread across numerous states within the United States. So let me transition and talk for a few moments about the Texas power crisis that took place in spring of 2021. I think probably everyone here remembers this event, but essentially it was caused by really cold weather, a storm coming through Texas, where homes, buildings, businesses, and the electricity infrastructure is not weatherized for such a storm. Demand for power went up rapidly to such an extent that it could not be met. Natural gas plants actually froze up and couldn't operate. So ERCOT, the Texas Power Group, powered down parts of the grid in order to essentially prevent total grid collapse. And so this led to sweeping outages across the state that lasted for a long period of time. And so to characterize these outages, we created, again, these relative and absolute definitions of outage. So we were interested in outages lasting longer than 24 hours that affected at least 20% of customers in each county. So before we were using 0.5%, we're now using 20% because these outages affected so many people. And then we also use an absolute metric of outages lasting longer than 24 hours and affecting greater than 10,000 people in a county. So this is work led by Nina Flores, who is a doctoral student in environmental health at Columbia Mailman with us. And here's a map that Nina created that I think is helpful. So you can see in yellow the ERCOT boundary. So these are the counties that are served by ERCOT and don't receive electricity from other states. The counties outside this boundary are those that could receive electricity from neighboring states. And then you can see this is summing up the number of hours that these counties spent with at least 10,000 people or customers actually in those counties not having power. So 48 hours is the royal blue. So that means for 2 days, at least 10,000 people in each of these counties did not have power. The gray are counties with less than 10,000 customers. So here's just another look at the same information. So x-axis, we're looking at time from early February 14th through February 2021. And the different colors represent different counties in the state of Texas. And the y-axis is telling us how many people are without power in that county. And so Harris County in Houston made up the most customers without power, followed by Dallas County and Tarrant County, both in the Dallas metro area. Oops. Anyway, so at the peak, at least 4 million people were without power during this crisis. And here's a look over time of kind of how this evolved from February 10th to February 24th. And here we're looking at the percent of customers in each county without power each day. So ranging from 20 to 50%, up to 95 to 100% in the darkest blue color. So several of these counties around Houston, almost the entire county was without power for the 16th and 17th of February. So some work has actually been done that's really great, looking at environmental justice concerns related to this outage. And this was led by a report through the Rockefeller Foundation with Jay Tanasia, who's at UMass Amherst, leading kind of on the power outage monitoring side of this. And so they actually use satellite imagery to be able to identify at the block group level, so quite fine geographic level, who was without power. And so this is an example of one of their figures, and this is looking at Houston, and you can see they're showing the percent of the population that had outages, and then they're showing the percent minority population. So the pink are places where a very large percent of the population was without power, and that a large percent of the population was people of color. And so you can see several parts of Houston where that was the case. And so they found some pretty interesting things. So using this census block level data, they actually found that about 10 to 11% of the population in predominantly white areas experienced a blackout during this crisis, but communities of color actually had about 47% of the population without power. So they identified really large disparities using this census block group level data. And so this kind of satellite imagery is super useful for really long power outages, and those that take place overnight wouldn't be as useful for identifying all power outages or those that are during the day, because we wouldn't be able to see where power was out using light, essentially. But a really cool method. I recommend checking out their report. Okay, so we did several things related to the Texas power crisis, but I'm going to just talk about a Qualtrics survey that we administered in April of 2021 to folks in Texas. And so we had about 1,000 respondents to our survey. We included questions on demographics, psychological distress, and power outages. And over 50% of the people surveyed reported experiencing a 24-hour power outage in the last year. So a lot of quite exposed people. So I just want to give you a flavor of kind of some of the things we learned from this survey. So we asked people how they learned about power outages. And you can see, in fact, the majority of people didn't know that power outages were going to occur. We saw also this gradient of social media use, which probably is not surprising, from younger age groups learning more from social media that a power outage would occur versus older age groups. But a lot of room for improvement here, right? So then we also asked people about their experiences during the power outages that they experienced. So this is among the 545 people that said they experienced a 24-hour outage. And we asked them what they experienced. So the largest number of people said they had discomfort from cold after the loss of heat in their home. A large number of them also reported a lack of lighting, which makes sense since it's a power outage, no access to the internet, unable to cook or get enough food, spoiled food, lack of clean water, dead batteries in electronics, discomfort from heat. So this obviously was not during the power crisis, because we asked them about any 24-hour outage in the prior year, and loss of power to medical equipment. So 55 people actually reported loss of power to medical equipment that people actually used regularly. And 13 people actually reported needing to go to an emergency room to seek healthcare. We also asked people about why they evacuated during power outages. The number one was loss of heat, but followed by not being able to cook food, not having light, needing to charge electronics, needing to use the internet, not having air conditioning, needing to use medical equipment. So 189 of the people that experienced a power outage, so about a third of the people that experienced an outage actually ended up evacuating. We also wanted to assess whether there were disparities in outage preparedness or experience. So we conducted a few different analyses. So using data on race ethnicity of the participants, we determined that Black respondents had 1.7 times the odds of reporting an outage compared to white respondents. We found that households where someone relied on electricity-dependent medical equipment were no more likely to be prepared for outages than other households. And we here define preparedness as the CDC's definition of a working flashlight, a 3-day supply of food and water. And finally, we've found a relationship between lower educational attainment and reduced odds of being prepared. And that's been seen in the preparedness literature in relation to other disasters. So not shocking, but provide some information on gaps and where we may need to target additional resources. Okay, so some overall conclusions. Okay, so we need more research on the health implications of outages. We have limited information on that to date. Like I mentioned, most studies are focused on a single outage, not these repeated outages that are occurring nationwide all year long. It would, of course, be useful to have sub-county level information on outages when we're trying to study health. And finally, we definitely need to consider environmental justice in order to equitably allocate preparedness resources, disaster response, and infrastructure improvements. So there, I think I will stop, say thank you to folks that worked on this and to Crisis Ready and NIH for funding this work. So thank you very much.
This was just super, Joan. Thank you so much for your time and the data that you provided. One of the things that was interesting to me, I appreciated the county level data analysis. When I look at your map, I see utility service territories. And I'm wondering, you know, as they're the ones who are responsible for ensuring operations in their service territories, just how you considered them as actors in the solution space. Is it possible that I froze?
Oh,
did you hear me?
I'm so sorry.
I think I'm
No.
back now. Okay.
Yeah.
So when I was just saying, when I looked at your map, what I saw were utility service territories. And I'm just wondering, you know, as those organizations are responsible for trimming the trees and keeping reliability of the system up, I'm just wondering if you've mapped your counties onto those service territories, because I know who I'd be pointing my finger at.
It's a great idea. No, we haven't done that yet, but we definitely can.
Yeah, at Louisiana Entergy, we'll have April Salas come and talk about her experiences there. But really, I mean, especially in the states that, you know, you usually have your distribution network operators that are, you know, exclusive service territory. And so how you would think that out would be a really easy way to say, you know, these are the organizations that aren't providing this. We had a couple of different questions coming in, and I'd want to encourage all of the audience to please put your questions in the Q&A. One of them was on what the huge variation in kind of the medical devices was, like what accounted for that across the different counties, or I think it was Utah that had a lot for some reason. And if you could just, if you have any insights into that space.
Yeah, I have some ideas on that. So presumably people using these electricity dependent medical devices have some underlying condition that requires them to use it. So a lot of them are things like oxygen concentrators. Some people even have something like a ventilator at home, which is a really extreme case, but it also includes things like CPAPs for people with bad sleep apnea. It includes batteries to power mechanical hearts. So it's a wide ranging group. And so, yeah, and all of these people aren't at the same level of vulnerability, I would say. Obviously, if I have a mechanical heart, that's very different than a CPAP machine, perhaps, or some other device that's not quite as necessary for me to survive.
Right.
And so there's a lot of so what the variability you're seeing doesn't get at that gradation of how ill these people are. So it could have to do with provision of care is one thing, because you need to get this from a provider. Everyone's on Medicare, so they should have the same access, but we know there isn't equal access to providers nationwide. And we do know that there have been changes in reimbursement for medical devices that has led to an uptick in some places over time. And so it's definitely linked to that as well. So it's possible that there are people that could benefit from these devices that aren't showing up there. And so there also looked like there's a huge amount of variability because we created quartiles and made them 4 different colors. So if it was a continuous scale, maybe it wouldn't be quite so stark to look at. It also very much has to do with the distribution of people of different ages, right? So as people get older and older and older,
right.
they're going to use more more of these. So a lot of reasons behind that, could be a whole analysis in itself.
Yeah, I just think it's really interesting. If you're thinking about being an emergency responder in a particular county, what type of data do they have now on who their vulnerable populations are and how to service people? Is there a centralized, and I know Sandy has been doing a lot of work on this too, and you probably know it better than I do, but I think our audience would be really interested in this.
Yeah, it's super interesting. And if I want people to be able to see a link, do I put it in, where can I put it?
Well, we can follow up later. You can put it in the chat and everyone can see it there. If you make sure that it goes to everyone.
Oh, I see everyone. Okay.
Yeah, and then we'll also try, and Stephanie will save it later and we'll put it on your website so we can have that.
Great.
That too.
Great. So I was just putting on here because this is one thing that we've started to think about is this Empower program through the federal government has been tracking where people at the zip code level with electricity dependent medical devices live. And there've actually been there's been a couple efforts to do like a pretend disaster and then go identify these people in order to try to help them evacuate or make sure they have backup power.
So that type of training we do for other type of emergency situations.
Exactly.
Okay.
So related to that. And I just want to point out, this is another group where there are huge issues of socioeconomic disparities because backup generators are extremely expensive. A couple $1,000s, or if you live in an apartment building, you can't have a backup generator, period, no matter how much money you have. And so really important to also think about that, I think, in the context of these devices with power outages and climate events.
One of the pieces that I've appreciated from talking to my colleagues who work on the grid and reliability in both Asia as well as Europe is compared to those continents, our stats are pretty abysmal. Have you done any sort of comparative study just kind of internationally with specifically, places of a kind of a similar socioeconomic level?
Yeah. So I have not done that yet. I'm not shocked because unfortunately we see that in many of our health indicators when comparing to other high income countries. We saw that with COVID vaccination rates and COVID deaths. We see this, and I think a lot of it comes down to income inequality in the United States, leading to a lot of these disparate outcomes that we might not otherwise expect. But no, that would be interesting to see. And I haven't looked at that yet. We are just trying to do this in the US first. So it would be interesting. And I actually don't know too much about kind of power outage response in, for example, the EU, or even kind of how their grid functions. I don't know that much about that. That would be
yeah, I'll hook you up with some partners when we're done with this conversation, because I think that would be a wonderful comparative study and one that we could kind of put in a bigger place. One of the questions here we have by Frank Fahey is, are the racial economic disparities being addressed by the authorities who can make changes?
I would say not yet. There has been, it's a tricky issue because solving some of these problems require huge infrastructure upgrades. And it's hard to figure out where to do this first. So some of the movement towards subsidies, for example, solar and storage, have been targeted towards low-income communities. Some of these improvements, we have a bit of that out in California. They base some of fund allocation from CalEnviroScreen, which is this environmental justice tool that allocates a portion of their cap and trade dollars to lower income, environmentally burdened communities. But nationwide, I would say no. And I also would say we didn't really know this existed until recently. And so there hasn't been, we suspected it could be a problem, but there hadn't been data to really show it. So no, not yet, but hopefully that's one of the goals here moving forward.
Yeah. I think that's really interesting. There was a request here from Tad Montgomery. Could you show the trend in power outages, especially in our area? And interested to see what it looks like here in northern New England. We appreciated that we were a very dark color, but what that looks like.
Yeah. Let's see if I can zoom. That would be nice. Okay, let's see what the best way to do that is maybe I'll just go this and I can just share. This. There we go. Okay, so here we go.
Oh, thank you. This is great.
So the black are the dark purple 5 to 7, and the almost black is 7 to 41.
This was the 0.5% of the county having
for the 8 hour.
Yeah.
The 8 hour counts.
Yeah.
So a lot of Massachusetts, not so great. Maine, really not great.
It's pretty impressive how you can see state borders pretty clearly on this, isn't it? I mean, again, utility service territories are a great way to start to think about these pieces.
And what is happening in Michigan? Yeah.
Yeah.
So,
another question from Dominic Caresse: is there a correlation between grid size and power outages or generation diversity in outages?
Yeah, I'm super interested in this question, and it's something we want to look at. We haven't looked at it yet. There's also big questions about what's the mix of generation on that grid. So as we are installing more renewables, for example, what do we see happen with power outages over time? I don't know the answer to that yet.
I think it's really different to think about the high voltage transmission system versus the low voltage distribution network where most of your outages are happening. And so the big outages in the transmission system are the ones that get all of our news attention, right? That was the Texas story. But when you look at the number, it's probably going to be much more distribution network system. And often, depending on where you are, squirrels are a big issue, but tree trimmings. And it's these kind of more mundane factors that aren't as exciting as
not so glamorous.
And but really practical. And so one of the pieces that I've appreciated moving up here to northern New England is that when they put in the distribution network, Vermont was mostly fields because they had a lot of agriculture before. But since then, you've had a lot of trees and forests grow up. And so, keeping those trees trimmed is now a much bigger issue than it was when they put the systems in a few decades ago. And so that land use change over time is kind of an interesting one too, as we think about it. Going forward. And I'm really curious, given your conversation, how do you think about rural versus urban kind of service risk vulnerabilities differently?
Well, yeah, that's a good question. So for us, thinking about health outcomes, rural health is difficult, right? Because these are people that are located really far from healthcare in general. And so, and have been much less focused on, especially, in a lot of our public health studies, because we just don't have the density of people to study. So that was one reason we were really focused on trying to get both urban and rural data here and be able to start looking, because I will be very curious what we'd see. And I'm also very curious, I might hypothesize a lot of the models we do when we look at health outcomes related to something like an outage is we run lagged models. So we'll see, what do we see on the first day that there's a power outage, and then 1 day later, 2 days later, 3 days later. And often we see kind of a peak 24 hours later, and then it goes back down.
By peak, you mean number of people with outages or number of?
Oh, the number of people seeking care for
number of people seeking care. Okay.
Yes. Yep. During as a result of an outage.
Yeah.
But I might expect those curves to look different in urban and rural areas. I would hypothesize there's more of a delay in care seeking in rural areas, but then perhaps that outcomes might be worse due to some of this delayed care seeking. And that's something we see with other climate events. So some of our work with wildfires, we see, for example, big reductions in outpatient care during wildfires, but big increases in hospitalizations. Okay. And so we expect kind of similar things where care is not really being provided in the way that it needs to be to prevent serious outcomes. And so anyway, I'd be very curious to look at these kind of, it's a good question. And we should think about that. But that's kind of my thought, but we don't know yet because no one's looked at it.
Well, and I just wanted to point you to the Dartmouth Institute, TDI. They've been doing, work on kind of healthcare costs and outcomes for a long time. So your question about the the devices, there's probably some researchers there that we could find for
Okay.
you too that can be good
Cool.
for that one. But I appreciate those differences. You're right in terms of getting care, in terms of what your vulnerability is. You had one county that was an outlier with 41 outages, 8-hour outages
Yeah.
over a 3-year period. Where was that? And
Yeah,
why was that?
I know. You know what? Do I know the answer to that off the top of my head? I don't
Your
know if I
researchers
do.
will. Your researchers will. We can get it later.
Yeah,
and
yeah.
put it in
Vivian
like a
definitely
special
knows.
quiz question.
I know. I mean, I'm guessing it's probably one of these counties that had the highest total customer time without. So either Wayne, Michigan, probably Wayne, Michigan, or Oklahoma is my guess.
Okay.
But I'd have to go back into the data and actually look.
Well,
Yeah.
and what was striking to me about your data was there are big parts of the middle of the country that actually had very good reliability.
Yeah.
And compared to the others. And so, like, again, who are those grid operators? What are they doing differently? Because those areas also have tornadoes and storms and other things coming through. So
yeah, that's true. Because yeah, even looking at I can just bring this back up for 1 second. So this is our total customer hours without power on average each year. And yeah, exactly. Like things are looking pretty good through
is that
here.
Nebraska? That's Nebraska, right?
This area, right?
That's South Dakota. South Dakota is Nebraska.
Okay. The white
Nebraska
means
does have a public utility. They have a like they don't have investor-owned utilities like the others. So yeah. But that's about very interesting.
So it is interesting. Yeah, you can, and even a lot of Texas looks better than the coasts.
Absolutely.
So,
But this is your customer hour, so that could also be a function of
population density. Yeah.
Yeah.
That's true.
There's your one without the population density. Yeah.
Yeah.
Nebraska still looks pretty good. So, this is really interesting. So there was also a question on if you had seen any trends in power outages over time.
Yeah, so we only looked at 3 years of data here, but we know from the EIA data that has been tracking it at the state level that we are seeing increases in outages. I think their most recent report just said 2020, maybe they just reported, was the most duration on average that we had experienced in terms of power outages nationwide. So they do appear to be increasing for the reasons I'm talking about, the aging grids, climate factors, and growing demand.
And you had mentioned if your temperature is above this, you're at risk. Do you have that same chart for if it's cold? At what temperature do humans start to experience risk in the cold? My students were asking this yesterday, so I'm asking this question for them.
I don't know the answer, but the place to get the answer is from the military, because they have so much research on this. Off the top of my head, I don't remember what those values are. But I don't think it's that cold if you're just sitting in your home. And especially thinking about children and older adults, those values don't need to be very extreme to lead to health implications.
There's a wonderful researcher at the American University of Beirut who studies older populations, because apparently as we age, we feel heat and cold differently. So we don't respond as rapidly. And so our core temperature can actually decrease more or less, depending on hot or cold, because we don't sense it the same way. There's a slowdown in how we sense it. And that's why one of her theories was that people get into more trouble, is because you don't feel it the same way as you do when you're younger.
Getting older is not that great, huh?
No, it's better than the alternative. It's better than the alternative, Joan.
It's true.
I'll take it.
Fair enough. That's interesting.
Just as we think about, what we're doing and how we're managing this and how these populations may need different informations at different times. Here's a question from Dominic Carese, who's one of our regulars. Is it economically, politically, or environmentally feasible to prevent all outages? That is, what are the other ways energy services often provided by electric power can be provided? Are alternative energy production methods more feasible or desirable?
Yeah, so I don't think I'm yet I mean, sure, no outages would be amazing, but I agree that's not where we're going. I think a few things we're trying to learn here are just at a very basic level, preparedness for our healthcare systems in terms of what to expect when an outage occurs. Two, I think it speaks to the need for community cooling and heating centers that have backup generation and storage on site. And of course, there are other ways that would be much cheaper. We know we need dramatic housing upgrades and building upgrades that are kind of the lowest hanging fruit for climate change in a lot of respects. And so if we can keep our homes naturally cooler in the summer and warmer in the winter, that will help a lot. Because if an outage lasts 12 hours, but we have good insulation or we have other mechanisms to keep the home at a reasonable temperature, then we're going to be much better off. And I think a lot of this will also be thinking about, folks here know much more about this than I do, but technology, essentially the smart grid, that we can allocate electricity to certain places that might be at higher risk, that we can kind of ramp down distribution rather than completely cutting it off. There are things that we can do, but it's going to be about communicating with people and having the technology in place to do it. But I agree. I mean, yeah, zero outages it's like inbox zero. It's just crazy.
Some people aspire to that.
I know.
Not me.
They don't have children.
Ed Warren just mentions that New England was 3 days away from a winter blackout in 2017, and that natural gas was diverted to homes. You saw that same thing happen in Texas as well. And if you have natural gas heating, that's great. And if you have electric heating, not so great. Up here in northern New England, we don't have natural gas for heating mostly. And so people are using propane or oil or wood or electric. And so that kind of legacy energy system and how it affects your thermal comfort or survivability, as you say, is also pretty important to think about when it comes to resilience. There's a lot of wood use up here too, which has the other air quality implications.
I was going to say, it's also complicated from, climate and just acute health outcome perspectives. But one
thing I wanted to ask you about, because I know there's been a lot of research in this of thinking about kind of energy reliability, but Hurricane Maria down in Puerto Rico really gave one of those huge system shakeups and examples where you had long duration power outages that affected health in communities and educational outcomes. And I'm wondering if you've looked into that at all in terms of kind of developing emergency responses, or if you have any insights there. No is a fine answer too. This wasn't the topic here, but I just appreciate that was another time when the US energy snow globe really got shaken.
Yeah. So I haven't specifically looked at Hurricane Maria, but what I can say is I think it kind of gives us a wake-up call of things we can expect going forward, the scale at which we're going to need to be able to respond, and how things can go really not well if we're not prepared at all. And it is, I'm talking about power outages, but it's really a power outage in a box. It's a power outage and a hurricane, or a power outage and a massive heat wave, or a power outage. There's these other factors like with Hurricane Maria that were going on where infrastructure was severely damaged. Health systems were completely broken down. So it's a little
parallel, these parallel linked systems that then collapse.
Yeah. And so I think it gets to the point that we can't just think about these things all by themselves.
In our normal silos.
Yeah.
So I really want to thank you for reaching across these boundaries and trying from a health perspective to pick apart the energy system and bringing in that equity dimension so we can really be thinking about the implications. I'd like to close with kind of your last thoughts. Tell us where you're going. Tell us what your big ideas are for the future. Any events you may have going on that people might be interested in.
Yeah. So let me mention one event that we have going on. So in the summer, I co-teach a environmental justice boot camp with Tamara James Todd from Harvard. I'm just putting it in the chat. And so that's a 2-day camp where people can come and kind of learn about theory and methods of environmental justice, which
perfect.
It books up fast. Last year was our first year, but it was fun, and I think students enjoyed it. So little plug for that. But in terms of power outages, yeah, I mean, we're moving on. We want to see kind of what the burden on health is nationwide related to this. So we're going to try to work with data from the Medicare population and look at hospitalizations after these events. We also are moving to look at the public safety shutoffs in California related to wildfires, because we do need to look at these like co-events going on at the same time.
Absolutely.
And then we're doing some work in New York where we have finer scale electricity provider data, and can get a little bit more granular in terms of who's exposed, and also to link to health outcomes statewide. So some more health work going forward, but always very excited to hear from other people, because every time I talk to someone in a different discipline, my studies get way better. So if people have thoughts, please feel free to reach out.
It's true. We need each other to be relevant.
Yeah. And just to move things forward. It's just, it happens a lot faster if we talk sooner. So, no, I think that's it. But thank you so much for having me. This was a blast.
Well, it's great to have another Joan. This is our first, Joan. So it's been fun.
Yeah.
So, Stephanie, we have some events that you are going to put up that we have going on. And here we go. So River Center, the Tuck River Center is going to be having their Power Up Thursdays, where they're going to be talking Nuclear 101. That's this Thursday. And then next Tuesday, the Dartmouth Energy Collaborator Series, Tribal Energy in North America after COP26, focusing in on the tribal nations. February 16th, we're having the New Energy Series with Dominic Bendar from Arizona State University, and this idea of energy as a human right. And so we look forward to our continuing conversations and engagement. As always, send me names for people who you'd like to hear in this series. Our job is to create a community and really highlight the work of some of the most interesting and best scholars out there who are shaping our field for the future. Joan, thanks again. Stephanie, thanks again for hosting, and we'll see everybody in a few weeks. Bye-bye.